Ready?
Go ahead.
Podcast Episode 2, Take 1. Welcome to our podcast series, So You Want to Be a Psychologist. Last time, we introduced Dr. Anindita, and she spoke to us about why she went into psychology and why she became a clinical psychologist. And today, we're going to dive deeper into what a clinical psychologist actually is. What does that title mean? And we're going to speak about how you get there. So for our listeners who may not know, what actually is a clinical psychologist? What does that role mean? And what kind of workplaces do you find them in? What is their responsibility? And also, how do they differ from something like a psychotherapist or a psychiatrist?
Well, let's go back to basics, Sarah. What is a psychologist? I would say the degree is essentially the first step towards further professional training and chartered membership in the UK. Many psychology degrees and conversion courses will also give you what's really needed, the GBR status, the graduate basis of registration. So now it gets a little confusing. People often assume once you got your degree, you can offer therapy. No, that's not true at all. So a bachelor's degree gives you the academic understanding of psychology, but the field is huge, as we know. Once that's done, you need more training to specialize. Yeah. The type of psychologist people most often come across is someone like me, clinical psychologist. I'm going to talk from that experience, if that's okay. So clinical psychologists, we train to doctorate level in the UK. Our focus is on treating mental health difficulties across the population and across different communities, mainly through therapy, but also thinking about mental health in its broader context. We're also trained to conduct research, audits, and take on leadership, consultation, and supervisory roles. Most clinical psychologists work in the healthcare settings, but we can also find clinical psychologists working in schools, youth offending centres, social care, prisons, corporate environments, and dare I say, some of the more entrepreneurial ones start up their own companies.
That's such a wide range under the one name clinical psychologist. And there are lots of other types of psychologists, right, as well?
Exactly. I mean, there's occupational, there's health, there's consumer, there's community, there's educational, sports, coaching. I'm sure I've missed. But the list is endless. The list goes on and on and on. Many of these titles are protected. So, for example, you cannot call yourself a clinical psychologist unless you go on the right training. I think, can I just say, Sarah, the beauty of psychology is the fact that it's so wide-ranging. It's not just therapy or assessments. We have a deep knowledge of human behavior, understanding research, and how to apply it in practice, and to think about qualities in services, and to take on leadership roles. So clinical psychology, we focus on the mind and therapy, and we can work with, as I said, across the populations and different communities. And by that, I mean physical, learning disabilities, neurodevelopment, not just mental health. We're trained to doctorate level, as I mentioned, and we often use evidence-based approaches. Psychiatry, on the other hand, absolutely, like clinical psychologists, diagnose conditions, but also are able to prescribe medication. And psychotherapists will often specialize in a particular model of therapy, and they tend to be at postgraduate level.
That's definitely a good distinction to make. I think a lot of people can kind of get confused. All these names sound really the same.
Yeah.
So to become a clinical psychologist, you have to do a doctorate in clinical psychology in the UK. So how did you get to that stage? When were you ready to apply for the doctorate, and how did you get there?
Absolutely. So I studied psychology at university, and if you remember from episode 1, I talked about at the age of 16, my calling was in clinical psychology. So I volunteered with a physical disability charity called Winged Fellowship when I was studying for my A-levels. And then I was a befriender at Mind when I was at university. And I also helped at a community centre for adults with learning disabilities. In the last 6 months of my third year, back in the day before Google, I wrote to every mental health trust I could find. And only Guy's Hospital wrote back to me. And a wonderful woman called Dr. Katia Golinka took a chance on me. This was the start of my working life from late summer of 2001. I began as an honorary assistant psychologist working in cognitive analytical therapy with borderline personality disorder patients. And then, as far as I can remember, I became the first assistant psychologist at St Thomas's Perinatal Mental Health Services. You talked about in the first episode about competitiveness. Well, this was my first introduction of competitiveness, getting an assistant psychologist post. I didn't realise how demanding I was one of 104 applicants. And in those days, that was big. That was a big number. And I stayed in that role for 3 years. And whilst I was in that role, I also did my master's at King's. I was very fortunate that St Thomas's Hospital funded the course and also gave me study leave. So my research focused on perinatal mental health. I developed an interest. I wanted to explore more about it. And my research supervisor was again another wonderful woman, Dr. Sandra Elliott. And we looked at how midwives could address pregnant mental health alongside the physical health. And it was wonderful because it showed research into practice firsthand. It influenced the practice at St Thomas's Hospital maternity ward. And even I got to present in Amsterdam. Amazing, yeah. I worked in 2 further assistant psychologist posts. One in an adult community dialectical behavioural therapy service in Goodmayes Hospital. And my final assistant post was in Croydon in general secondary care, general adult mental health. Whilst I was doing all of this, I joined the British Psychological Society, BPS, and the Division of Clinical Psychology. I also joined assistant psychologist groups, and I would suggest our viewers and listeners to do the same. Now, some groups were excellent in terms of sharing tips for applications, journal articles, and workshops. Others were more competitive. But peer support was invaluable, though, and I learned about competitiveness and not take it personally. I think that's a really important lesson that I got from it. I also became a pre-qualified chair for the Division of Clinical Psychology. That gave me an early taste of leadership. It involved representing aspiring psychologists like you, supporting them, and raising important issues within the profession. So by 2006, I felt emotionally ready to apply for training with strong experience, research, and support. I also felt connected to the profession through my work with the BPS.
I think it's really important that you highlight that you need to be emotionally ready. I feel like a lot of people kind of rush and just want to get onto the doctorate, but I think it's definitely important to highlight that you apply when you're ready, and that's not the same for everyone. I'd like to ask you about the actual application. How did that go? Where did you decide to apply? And what was actually writing the application like?
Well, I applied in December 2006, which feels like an age away. Carefully, I remember drafting and getting feedback. I chose referees who really knew me well. And I think that's a tip that we all should think about. In my case, because I was London-based, I applied to Solomons, UCL, and Essex, and I also applied to Exeter as well. I was very fortunate to get 4 interviews. The interview invites came in my time between February and April 2007. It is different now. Interviews ran until June.
Mhm.
I attended 3 of the interviews because I decided I was going to go to Salmon's because of his integrated approach. I believe it's really important to read about each course and its approach because the training shapes the kind of clinical psychologist you'll become.
Yeah, that's really interesting. So it kind of sounds like to me the journey to the doctorate is long, but incredibly rewarding. So do you have any advice for someone that's at the beginning of this journey, someone that's just starting out and their aim is the doctorate? What would you say to them?
Firstly, I just want to bring up the point. It is long. It takes a year from applying to being accepted on the course, so bear with the process. Now, in terms of advice, I think the path to clinical psychology can be different for each of us. As I said, that was my journey when I was explaining. People have different journeys. Not one size fits all. apply when you feel ready. And I'm just going to say that same to you, Zara. Yeah, because you're going through that process. Please be patient, Zara. Use your early years to explore, reflect, and build your skills. Seek out those supportive mentors. Yeah? I always recommend talking to newly qualified clinical psychologists because they will have the most up-to-date information.
Amazing.
Yeah.
Thank you so much. So today we talked about the application, and that's just a teaser because next time we're going to be speaking about the doctorate itself, all about the workload, all about the teaching, the placements, and what it is like. So join us next time to hear more about it.
I look forward to it.